Assalamualaikum. Good morning. My name is Dr. Azizan, one of the fellows in IJN. Today I'll be talking about chronic hyperglycemia as a predictor of acute kidney injury requiring continuous renal replacement therapy in patients undergoing coronary artery bypass graft surgery. As a background, chronic hyperglycemia with HbA1c is an indicator affecting postoperative care after CABG. Acute kidney injury is one of the frequent postoperative complications of the CABG, impacting short and long-term outcomes, such as AKI, as mentioned earlier, requiring CRT, infection, prolonged ICU stay, and even mortality. Most patients that undergo cardiac surgery will undergo preoperative assessment, including blood tests. And one of the blood tests is HbA1c, where it measures the average blood glucose concentration preceding 2 to 3 months, regardless of the presence of diabetes. The objective of this research project is we will investigate the association between chronic hyperglycemia and postoperative incidence of AKI requiring CRT in CABG patients. In terms of methods, this is a retrospective study which was conducted over 4 years period from 1st of January 2016 until 31st December 2019, who underwent isolated CABG in IJN. Patients are divided into 2 groups. The first group is HbA1c equals to or less than 6. Second group is patients who have HbA1c of more than 6. Primary outcome measure was the incidence of acute kidney injury that leads to CRT. Secondary outcome measure were mortality, chest reopen, length of ICU stay, and total hospital stay. Inclusion criteria include adult patient, elective CABG, and normal LV function of EF of more than 50%. Exclusion criteria, patient who has CKD and off-pump CABG. In terms of results, there are a total of 6,018 patients of isolated CABG, which was done over the 4 years period. Based on the exclusion criteria, 3,999 patients were excluded, and total of 2,019 patients were included in the study. As a baseline characteristic, most patients are male. The average age between those 2 groups it's about 60 years old. Most patients are Malay, especially in the more than HbA1c of more than 6 group. And it's quite interesting to know that the patient who have HbA1c of more than 6 are slightly obese than the other, shown by the higher BMI. And also, patient has a higher HbA1c, has a higher increase, higher incidence of diabetes, hypertension, and high cholesterol. These are all p-value of less than 0.05. In terms of the primary outcome, so this study shows that there's a higher risk of CRRT in the HbA1c of more than 6 group. Okay, it's about 1.5% compared to the group of HbA1c less than 6, and the p-value is less than 0.05, which shows that the result is quite significant. In terms of secondary outcome, okay, it's interesting to know that the mortality, even though the mortality is higher in the HbA1c of more than 6, however, in those 2 groups, the mortality, there's no significant difference in terms of the mortality shown by the p-value of more than 0.05. And this is also also shown by the chest reopen, where chest reopen there's no statistically different. Again, the p-value is more than 0.05. Okay, in terms of the secondary outcomes I mentioned earlier, I was measuring the ICU length of stay and total length of stay. It's interesting to know that there's the patients who has a higher HbA1c stays longer compared to patient who has a lower HbA1c, especially in the ICU. Okay? And also in the total length of stay, the patient who has higher HbA1c stays longer compared to the patient who has less than, compared to the patient who has HbA1c of less than 6. Again, this study shows that the p-value is 0.05, and the result is shows that it's statistically significant. Okay, what can I conclude from this study? This study shows that the chronic hyperglycemia defined on a single measurement of HbA1c more than 6 was associated with higher incidence of AKI requiring CRT. Length of both ICU and post-op hospital stay were higher in the more than HbA1c more than 6 group. This finding might implicate the importance of sugar control preoperatively, especially in diabetes patients. Okay, discussion. HbA1c is a very good marker to assess the long-term and the glycemic state of the patients weeks prior to the surgery, and HbA1c is also a good indicator for insulin resistance. Additionally, HbA1c is an easy-use laboratory marker. This makes this test fast and cost-effective. This study showed that mortality is similar to both groups. This could be because of it's a small study sample, and also it's a retrospective study. The limitations of the study, as I mentioned earlier, is a small sample size. The study was conducted from a single center. This is an observational study which only reflects the group of patients at one specific point of time. This study also did not independently analyze the effect of mortality, length of hospital stay, and length of ICU stay. Thank you very much for your time.